There are two aspects to any physician's job: caring for patients, i.e. doing things that directly impact and help the patient at their bedside, versus the rest of the job that helps keep the system running smoothly. With so much to do, it's no wonder there's never been a higher level of burnout than in today's bloated corporate healthcare system. Example 1. Imagine you're in pain as a patient and no one has attended to your needs yet, and you hear it's because the doctor or the nurse is busy. You think they're probably busy doing something more important, like dealing with someone sicker. How furious would you be if you found out they were actually occupied with paperwork and notes instead? Example 2. Let's say you're in residency, exhausted and sleep deprived. Option 1 is to allot 90 to 95% of your brain cells to patient care and forego the admin until tomorrow. What happens? You get reprimanded, lower your attendance percentage, may fail the rotation, and risk being branded as lazy. Unfortunately, the only way your boss in the office sees your work is if they see the paperwork. The next time you'll allot your last 10 brain cells to admin at the expense of patient care, because you were judged more on the admin side of things than the actual patient care aspect. After years of this, you start to forget what your real job is. Unfortunately, that's the stark reality in today's medical landscape. This came about after decades of small, incremental changes in standards of care made by well-meaning individuals to prevent the impact of the lowest common denominators, like the surgeon operating while intoxicated. The system continues to get bigger with more moving parts, more logistics, more fear of repercussions, and a higher propensity to practice robotic, defensive, and algorithmic clinical medicine. This eventually leads to more administrative burdens on everyone involved. For instance, increased charting, notes, emails, modules, and paperwork, leaving less time for the actual patient. Eventually, this leads to a decrease in autonomy, where we're no longer allowed to do things that make sense. This, combined with zero change in liability, where if something goes wrong, we're 100% liable, is guaranteed to eventually turn your passion into just another job. Give me 6 months and the most passionate, brilliant, creative individual. Think Leonardo da Vinci. In these circumstances, I can turn them into a soulless, burnt-out automaton, judging him not by his actual art and inventions, but by his documentation, making him clock in, adding more chains and restrictions until eventually the last sign of life behind his eyes is put out. So when you start feeling this overwhelming feeling and burnout next time, just remind yourself of all the reasons why you first got into this field. Remind yourself that as long as you take the best possible care of your patients as you can, as long as you are understanding and empathetic, and your patients get the care they need, nothing else matters. The next time you start to feel like just a cog in the machine, remember that you are not a cog. You are the engine that makes the whole thing run.